Yeah, it's like all the time. There are 4 episodes when I notice that my whole urine is red in color.
Okay. Do you have any lower tummy pain?
I don't have any tummy pain.
All right. So you told me that you've been having the blood in urine throughout the time, right? And it's been 4 weeks. So
Yeah,
have you noticed anything in particular that aggravates the problem?
no,
Okay. Did you do anything about it? Have you taken anything for it?
no. I'm just coming here hoping that you will provide some solution.
Oh, sure. I will definitely do that. Do you have any burning pain during your urination?
No,
Have you noticed any recent changes in your urination? Like if there's any increase in your frequency?
no.
All right. So is there anything else apart from this blood in your urine?
Like what?
Any loss of weight recently?
No,
Any fever?
no,
Okay. So any headache?
no,
Any shortness of breath?
no,
Any heart racing?
no,
Any back pain?
no.
All right. So is there any medical condition like diabetes or hypertension you're suffering?
Uh, no,
All right. So do you take any medications?
no,
All right. So is there any allergies that you're having that you want me to know?
no.
All right. Do you smoke?
No.
How about alcohol?
No, I don't. I don't
All
drink.
right. So can you tell me about a bit more about your diet?
Yeah, I try to eat healthy food.
Mm-hmm. All right. So you told me it's been this problem for 4 weeks. So how's your life going on?
Yeah, it's very stressful. All the time I'm thinking, what if it's something serious? Because, it's not usual to have blood in the urine.
Yeah, that's right. It must be really hard. I can understand. So what do you do for a living?
I'm an accountant.
Okay. So can you work as usual? Like you told me it's stressed. Is there anything else I can help you with the work?
Uh, that's it. Like, I'm just thinking about this. Otherwise, my work is fine.
All right. So may I know whom do you live with?
I live with my wife.
All right. So I'm going to ask you some personal questions. It might be a bit intrusive, but please bear with me.
Mm-hmm.
Do you have any penile discharge?
Okay, discharge. No.
All right. So thank you for answering those questions, Mrs. Zimmerman. So I'm going to examine if it's all right.
Okay.
I'm going to take your observations, which includes heart rate, respiratory rate, blood pressure, oxygen saturation, and temperature. I'm going to examine your private part and also as well as abdomen. I will have a chaperone with me to ensure privacy. Okay.
Okay.
All right. So from the information you've shared with me, Mr. Zimmerman, I suspect there are some problem with your kidneys. All right.
Mm-hmm.
So do you have any idea what might have caused this?
No.
All right. What I'm going to do is I'm going to, first take some blood tests done. Mhm.
Okay.
So I'm going to do some full blood count. I'm going to do some UNEs. I'm going to do some urine analysis, and I'm going to do some more blood tests done in my GP. All right.
Mm-hmm.
So do you want to know what might be causing the problem?
Yeah, of course. Like, I really want to know what's happening.
Yeah. About that, you told me that you've been having this blood in your urine for around 3 to 4 weeks. So, what I'm really worried about is it could be something as simple as some kind of infection in the bladder, or sometimes it could be something, really worried about some of the age-related growth in your bladder.
Okay.
So,
2 minutes remaining.
So, do you want to know what we're going to do for you?
Yeah, please tell me, is it treatable?
Come again?
Is it treatable?
Yeah, as of the moment, this is the early part of consultation. So what I'm going to do is I'm going to run this test and I'm going to refer you to a specialist called urologist, all right?
Mhm.
And nephrologist is also needed, okay? They might be doing some more investigation, like putting up a camera through your penis called cystoscopy,
Okay.
okay? And this investigation gives them a clear picture of what you might be suffering from, okay?
Okay. Doctor,
So
like,
based on,
do you think it could be something serious like a cancer?
yeah, I'm not really sure, but as I told you, it could be something as no less concerning as urinary tract infection or something more sinister like some growth or cancer.
Okay, okay. So what if it is a
But
cancer? How do we treat it?
yeah, if it's a cancer, the specialists are going to give you some options like maybe a surgery or a chemotherapy, radiotherapy, depending on the level of the growth. Okay.
Okay, all right.
They, all right. They're going to do some more investigation. They're going to take some big scans like CT and MRI to stage them, and they're going to give them treatment based on the level of disease you have. Okay.
Okay.
So apart from this, do you have any other concerns?
Uh, that's it. Like, should I be worried about anything?
I'm really hope for the best. So what we're going to do is we're going to refer you within 2 weeks referral. Okay.
Mhm. Okay.
So if in case you have any other problems apart from this, you have anything.
Move on to the next station.
All right, Dr. Mohammed, what do you think?
I don't know, doctor.
Mhm. Like, so what is your idea? So let's say you got the station in exam, you perform just the way you did right now. So
Uh-huh.
your friends are asking you, how was the station? So what will you tell them?
I will tell them it's doable. I think that I have some clues from the patient's patient is a male and his age is 57 and he doesn't have any pain and there's a painless hematuria. So it could be something like a cancer. So I think I moved it on a right way. Like,
Okay, so one of
I
your
think
potential is cancer. Okay, that's fine. Apart from that, what do you think? What are the other differences possible?
apart from cancer, there might be stone which might be causing hematuria within a short span of time,
Okay, what
and
else?
also something like a urinary tract infection.
Okay, what else?
Um, um, maybe something like a bleeding disorder. So if he has some medical condition and he's taking any medication, that medication could have also caused this hematuria.
Okay, what else?
Mm,
When does somebody bleed? What happens? When does bleeding happens? The
doctor,
What
can
are
you
the
please come again?
what are the other possibilities that can lead to bleeding in somebody?
Trauma,
Trauma. What else?
any recent instrumentation.
So this is possible. You are still missing out on something really important. So leave the differentials. Apart from that, let's talk about your IPS. What do you think about your IPS?
Uh, I uh, I think I given him you know I've addressed his concerns. I asked him like, "What's your concern?" and all, and he told me that I'm not really worried about. Like I met, I think I met all those concerns that he has, and
So
I also assessed
when
this.
I told you, doctor, I'm really worried. Like I keep on thinking, what if it's something serious? So what was your response to that?
Please don't worry, we are here to help you about that, and we're going to support you throughout, something
I
like that.
think what you said was, I can see that it can be really worrisome, something like that you said, but I don't remember
Yeah.
getting the support when you, like patient is worried.
Yeah.
Okay, I
Yeah.
can see it's worrisome, but you should also tell them, this is IPS. Like if you're really
Okay.
patient centric, and you should tell them, well, don't worry, we will, try our best. We will see what we can do for you. Okay, we will do our best. Something like that should also be accompanied, because otherwise,
Okay.
like patient is suffering, and you're just acknowledging the suffering. That is good, but you should also provide some support. Okay, at least verbally say something. That is very, very important. And also, I felt that your signposting was not enough. Like you were just kind of moving on to one step to another, differentials. Then you straight away started asking Meftosa. No signposting was done in between. It was not really, professionally. It was not sounding professionally. It was just like you were trying to follow some structure. So
Okay.
we will talk about that in detail. Now let's take the feedback from the doctors who have been listening. What do you think about it? And what was the most important things that you missed? Anybody wants to say something? Did anybody here follow the station? You can just speak on the mic, like rather than texting. It's better that you speak, because it's a speaking exam. It's not a writing exam.
Hello.
Yeah, go on.
So I think that he missed asking about cancer symptoms, lost weight, and
I think weight loss.
lumps
Yeah,
and bumps.
Dr. Mohammed.
Yeah, I asked about the cancer side.
Weight loss. Yes. Yeah, he asked fever,
Yeah.
weight loss, lumps and bumps. He didn't ask, but it's fine. Weight loss. Yes.
Yeah.
Okay. Apart from that, Dr. Ali, anything else?
Bleeding anywhere else?
Yeah, that's good. He missed out. What else?
Yeah.
Anemia. Could be dizzy.
Yeah.
He asked that.
I asked about the animal pumps.
Okay. Apart from that, anything else?
If he had
Kidney
worked in any
problems?
factories before,
Sorry.
if any factories like dye factories, aniline
Aniline
dye,
dyes. Okay, that's for bladder cancer. That's good. What
bladder
else?
cancer.
Anything else?
Back
Family
pain
history.
back pain.
Prostate symptoms?
What symptoms?
Prostate?
Prostate symptoms. Yes, this was what I was totally missed. He missed out. Like he forgot that prostate is something that can exist in the body. I think. So
Doctor, I asked about the prostate. Like I asked you if there's any problem with your urination frequency recently, about any frequency.
No, that's different.
no, I don't remember you asked. You should ask like properly. By any chance, are you going to loo too often? Are you difficulty in starting the stream? Any changes in the stream? Is there urine dribbling on your underpants? So you should be more
Okay.
find it difficult to empty the bladder. These 3-4 questions must be asked.
Okay.
And examination, back passage examination was not done. And if you would have done it, I would have told you the finding.
Okay.
It's a very crucial thing. You cannot miss in this case. Okay.
Okay.
All right. Anything else? Anyone?
We can also ask about the travel history, and we can also ask, by any chance, are you eating any beetroots? Because beetroot
We
also
could have
bread urine.
All right. Okay, Dr. Maria, that's fine. That's good. Anything else?
sexual history. Sexual history.
Sexual history can be asked. Not very important in this case. Hematuria is not very much related to sexual history. So if there is time, you can ask. Anything else? Anybody wants to say something? Dr. Kubra is there. Do you want to say something? The hand is raised. Anyone else? Did you find any mistakes in his consultation that you think needs to be corrected, or anything you learned from him? Any comments?
We can also ask, by any chance, have you ever been diagnosed with stones before, kidney stones before?
Probably not very important, because there is no pain. Okay, so he already ruled out pain. So one thing that there are a few things I will definitely give you detailed feedback, Dr. Mom, before let me get
Okay.
started. So yeah,
Sure, doctor.
anything else? Anyone? Okay, so it seems not many people have heard the station properly. Okay, so what is the diagnosis? Anyone else from the audience?
Cancer.
Prostate cancer.
Okay, prostate cancer. Okay, what are the other options?
Bladder cancer also.
Bladder cancer.
renal cell carcinoma.
Okay, what else? All right, let's look at it now. Let's look from the beginning and let's decode the whole station, how to do it. So first thing is in Plab2 station, GRIPS, okay? Greeting, repo, identity confirmation, okay, and IPS. So greeting, it did, hello, this is, are you Mr. Zimmerman? Yes. Can you please confirm your age, 57, okay? So Mr. Zimmerman, how can I help you today? Doctor, I'm having blood in my urine from 3-4 weeks. So after that, I don't know if he did, but you should respond because hematuria, blood in the urine is not some, simple complaint. You should be little more sympathetic, empathetic. You should say, this sounds quite bothersome for you, Mr. Zimmerman. Don't worry, you have come to the right place and we will see what we can do for you. Okay. This little.
But can I comment on that?
Yeah, go on.
I mean, it's not our fault. Why do we have to sympathize at the beginning? He have problem, and it's not something that he still is affecting his life. Maybe we'd sympathize if it's affecting his life, or
no, it's not just sympathetic. It's about acknowledging somebody has come with some complaint. If a random person comes to you and share something with you, you should, at least make sure that you acknowledge him, that you have heard him properly, and you will.
Yeah, all right. But just, acknowledge, sympathizing at the beginning. When he just say that, doctor, I have only pain. I have blood in my urine.
Mm-hmm.
It sounds like you are scripted. Doesn't sound like that.
Oh, yes, doctor. That's the reason I was not asking it, because like in the routine consultation, we don't be asking, like we don't be
because in
acknowledging,
our real practice, we don't just sympathize at the beginning. We don't we sympathize when.
Okay, Dr. Ali, I will give you respond to it. Okay. So yes, doctor, I'm having blood in my urine. It's been 3-4 weeks. So what is your response?
Okay, maybe it's for a long time. I can see it must be really quite challenging to deal with that.
Yeah, that's what I'm telling you. That is what you have to say. So this is what is called acknowledging, and you have to build rapport also. Just keep on like robot, you keep on asking, okay, can you tell me more about this, how much blood, this, that. Everybody will do that, but IPS is also what you need to put in between. So you should say, okay, that sounds quite challenging, or that sounds quite bothersome. Don't worry, we will see what we can do for you. Okay, and let me ask you some more to get to the bottom of this. So this is basically called rapport building. Okay? You have to build the rapport when the patient gives you the presenting complaint. That's a very good opportunity for you. Okay, and it also gives you some buffer time to think. Okay, so meanwhile, suddenly somebody comes with blood in urine. You can't in a split second, you cannot think everything else. So you need some buffer time. So use this time, okay, to build rapport and also to make a thought process, okay, for how to go ahead. All right, so I think you can incorporate that in your practice. So next is hematuria. So you have to explore hematuria. Instead of that, what you did was, do you have any pain in the tummy? So that was odd. That is not professional, okay? The patient is saying, I have blood in my urine. You are asking him, do you have any pain in tummy? That's not a wrong question, but it's a wrong time to ask. You can ask later on. But suddenly asking as a pain in tummy, that doesn't sound professional. Before that, you need to explore the hematuria. Can you tell me from how long has it been happening? How did it start? Oddipara, okay? Anything makes it better or worse. How many episodes? 3-4 episodes. All right. Okay, and how much blood can you tell me how much blood is coming? You didn't ask the quantity. Quantity is very important.
Yeah.
If there is a lot of blood, maybe it can be serious, right? You need to ask what is the, is it a fresh, red, brown? You need to ask that. Are there any clots in the urine? Okay. By any chance, did you have any pain? Then you can ask some differentials. After you explore, then you can ask some differentials. So pain very important. Do you have any pain while passing urine? Rather than asking pain in the tummy, ask any pain while passing the urine. Because of painless hematuria, we need to rule out for bladder cancer. Then you ask about the UTI symptoms. You can ask, do you have any pain, burning, maturation, any smell in the urine, any pus in the urine? Okay, then ask about PPH symptoms. Okay, and before asking these differential symptoms, do some signposting, which was missing in your consultation. So you should always say, okay, Mr. Zimmerman, now I would like to ask you some yes or no questions just to rule out some possibilities. Okay, this will align. Why this is so important is, one is that it will fetch you IPS marks. Second is that it will also, arrange your thought process into one process. Like you will be more professional in your consultation, and you won't less likely that you will miss things. Okay, when you are, because you're training your brain. When you signpost the patient, you are also signposting your own brain, and your brain starts thinking like that. When you
Okay.
give a signpost, okay, now I'll ask you some yes or no question. Your brain starts thinking like, okay, let me think of some differentials now. So that is a very good trick that you must employ. It will phenomenally change your consultation. Okay, now let's ask you some yes or no questions. By any chance, are you going to loo too often these days? Okay. By any chance, do you have any difficulty in starting the stream, urine stream? Okay. By any chance, are you dribbling on underpants after passing the urine? Okay. Are you able to empty your bladder? So you need to ask this prostate symptoms. Most likely he will have some symptoms, because this case, which is coming frequently in the exam, this is not a particular diagnostic case. This is more of a differential. So you have to tell some differentials in this case rather than pinpoint
Okay.
this is the condition. So this case
Mm.
points towards both bladder cancer as well as BPH, because the examination finding will also tell you BPH and history will also point towards that. So you can't miss BPH in this case, otherwise you will lose a lot of marks because it has BPH component in it. Then next, after that, you also need to rule out anemia. So you should, here also you can signpost just to be on the safe side. Let you know, sometimes losing blood can lead to some severe complications. So just right, by any chance you experience any heart racing, any shortness of breath, here also you can signpost. So this will make sure that you are thinking in one right direction, and examiner will follow you, and patient will also feel good that you are trying to include the patient. So try to signpost as much as possible. Then moving on.
Okay.
So there also you didn't signpost, you straight away went, do you have any medical conditions, diabetes, hypertension? So use layman terms, okay? Always use layman terms that can increase your marks. So say, instead of diabetes, say, do you have any high blood pressure, high blood sugar, okay? So this will, this patient appreciates this, and examiner will also appreciate that you're trying to, speak layman terms. Then
Okay.
say some signposting before or past medical history. Okay, John, let's talk about your general health now. By any chance, have you been diagnosed with any this condition? Are you taking any long-term medications, any supplements? All right. Any allergies? Okay. In your family, anybody having any similar complaints or any conditions, any serious conditions? All right. Did you travel anywhere? What do you do for your living? So ask all these questions, Maftosa, and social history. So psychosocial history, you did ask like, how is it affecting your life? That's really good. You must ask that question. And there is a long symptom, and it's kind of a serious symptom like this. So you should ask these kind of questions. Then moving forward to the social life also includes lifestyle, diet, exercise, smoking, alcohol. I think you did ask that. So you did ask,
Yeah.
but that you missed out on travel history, I think. And in diet, maybe you can ask about beetroot specifically, because that is a common reason that urine can turn red, and strenuous exercise as well. So you can be little more ask closed-end questions there.
Okay. Doctor, why do we ask travel history? Because to rule out any malaria symptoms or something like that?
So travel history is for schistosomiasis.
Okay. Mhm.
So next move, so this is the history. Then thank the patient. Thank you so much, Mr. Zimmerman. Now I would like to move on to the examination. I'll start by taking your vitals, your blood pressure, respiratory rate, oxygen pulse rate. You mentioned that. I would like to examine you head to toe. I think you mentioned. I would like to examine your chest for your heart and your lungs. You didn't mention. Heart examination is important in this. Then you mentioned abdomen examination. Many students have a series that using these terms, abdomen, this, that. This is medical jargon. Small things will, these things stay with the examiner and they will mark you down, and this will make a difference of 0.01, which can make a difference between pass and fail. Use the word tummy. What is the, why you can't use layman terms? That can make a huge difference. So always use the word tummy instead of abdomen. So now I would like to examine your tummy. Okay, I would also like to examine your back passage and your private area. And I'll ensure your privacy. There'll be a chaperone. So you missed out on back passage examination and you missed out on.
Yeah.
Okay. Then moving.
I told tummy examination, doctor.
Yeah, you did, but you didn't. You said the word abdomen, so I won't consider it. You should use tummy. Okay. So then moving on to the diagnosis. So you said it seems you are having some issue with your kidneys. You said that. Okay, all right.
Yeah.
Then you said, okay, there is some problem with your bladder. So kidneys is something else, bladder is something else. So you can.
That is something else. Yeah.
You have to be sure before telling the diagnosis. You should ensure that what you have to speak. You can't fool the patient. Patients are much more intelligent in that station because they have been doing it over and over. They know everything. So you can't fool the patient. You can't fool the examiner. So you have to be specific. If you are not sure what is it, at least do eyes properly. Do you have any ideas? Maybe patient will give you hint. Okay, any ideas what could be happening? I don't know if you ask that. Concerns you did ask. Expectations also probably you ask. but ice was not properly done. You need to do ice. Then you need to do the basic investigations along with the examinations also. I like to run some basic investigations: full blood count, liver function, kidney function, clotting profile, and urine dipstick. Okay, urine dipstick might also give you hematuria. Then the diagnosis. So, Mr. Zimmerman, from all the information that you have given me and my findings, I'm suspecting that it could be something related to your bladder. Okay, or there is a possibility that there is a gland called prostate, which is located at the neck of the bladder, is involved as well. So I'm not sure at this point, Mr. Zimmerman. So I need to involve my seniors. So then involve seniors, then I would like to refer you to the specialist. So in this referral is very, very important. So try to do it as soon as possible. We would like to refer you to the specialist within 2 weeks. Okay. Do you have any questions so far? Okay. Then tell what specialist will do further, because at this point we can't do anything here. So the specialist has to do cystoscopy. So explain about cystoscopy in patient terms. Then talk about ultrasound, like you need to do ultrasound scan of lower tummy as well for prostate. Okay. Then you need to tell about biopsy has to be done. Maybe PSA testing will be done also to see what is happening exactly. And according to the condition, treatment will be provided. So if there's a bladder cancer, we will do treatment that. If the prostate, so it's not a prostate carcinoma is very unlikely, because examination finding will be smooth and enlarged. Okay, carcinoma mostly will be irregular. So this will be enlarged, and there will be probably BPH. If it's BPH, then we will give you medications to reduce the size of prostate, or we will give you medication. We might do surgery to cut the part of prostate, or we might give you medications to widen the path of the urine so that urine can flow. So this is how you have to provide the treatment. Then safety netting for the anemia. You must safety net for the anemia and tell him to call 999 immediately in case he develops any shortness of breath, any chest pain, or any heart racing. Is it clear?
Yes, doctor.
So major feedbacks that you must employ signposting. That will make a lot of difference in how you consult the patient. Second, you must use the layman term. And third, you need can't miss BPH. You need to properly ask in this. Okay, and examination. Examination, you cannot miss back passage examination in this. These small things will make difference in your whole management. So you cannot miss these things.
Okay, doctor.
Any questions from people who have been listening? Okay, and you need to be, so your exam is on 20th, right?
Yes, doctor.
You have almost 2 weeks or 13 days. So try to practice every day 3 to 4 cases, okay? And try to read, self-read. Now, from now on, I think you should spend more time on self-reading and revising, because you need to remember some information. But at the same time, try to practice 3 to 4
stages. Oh, sure. All right.
Okay, thank you so much.
Yes, so thank you. Thank you for your feedback.
So who is the next person? Dr. No.
Dr. Al.
Dr. Eldrin was there. Is he here? Dr. Eldrin?
Yes, doctor, I'm around.
Okay, yeah, we can hear you. So we'll move on to the next session. So meanwhile, let me tell you that these people who are not aware. So this is a 5-day course that I have been conducting from quite a long time now. So next session is happening from June 11th, and it will include a lot of, it will cover over 100 cases, and there will be a lot of sessions like this with private group of people, and we'll be doing detailed corrections. There'll be many mock recordings included. So it's a 5-day course, intensive, and it will cover many things. Okay, let's move on to the next section. People who have been listening, please actively participate. I want all of you to give the feedback at the end of the session. Whatever is your level of preparation, doesn't matter. You should say something. Okay, that will increase your confidence also. And this exam is all about being confident and speaking. You know, even if you don't know how to speak confidently, that is also one skill that you have to master. So we'll begin in 30 seconds. So this time, use the time that you have to read, make structure in your mind. Try to visualize how patient will be there inside. What is the structure you have to follow? Okay, if you have visualized and imagined the whole situation in your mind, then it will be easy for you inside the room.
Begin.
Hello,
Hello.
I'm Dr. Aldrin, one of the junior doctors in the department. May I confirm your name, please?
Yes, doctor, I am Andrew.
All right. Nice meeting you, Andrew. And may I confirm your relative's name and age, please?
Yes, doctor, I'm grandson of Mr. Adam, who is 92 years old.
All right. Okay, Andrew. So do you know what you're going to talk about today, Andrew?
Sorry?
Hello?
Yeah, can you say again?
Hello?
Yeah, hello, can you hear me?
Yes. So, Andrew, can you quickly give me a brief background of what's going on with your your grandmother?
Yes, my grandmother, like she is really ill. They are saying that her lungs are not functioning anymore, and she is not in a good position, doctor. Like her health is very bad at the moment.
Okay, I'm sorry to hear about that, Andrew. So how have you been coping lately?
Well, we are trying. Like my whole family has come. We are all getting together, and we are trying to do some of our religious um, processes so that it can be good for my grandmother.
All right, all right. Yeah, it must be really stressful time for you, for the whole family. So, if I may ask, so how many relatives are coming to visit her?
Yeah, we have a very big family. Almost like 20 relatives are coming.
Oh, okay, okay. And do you take turns, or you just come all at once?
No, no. This is something that we can all do together only.
All right, Andrew. So, and when you visit your grandma, what do you usually do?
So we are just planning to do some of our, chants and prayers that will help my grandmother. Probably she will recover, or it will also help her to depart in case she, dies. It will be good for her to, she will rest in peace after that.
Okay, okay, okay. Yeah, so that's very good that you're very supportive of your grandmother, and that everyone is coming to give her paying their respects. So, but unfortunately, Andrew, do you know the hospital policy about the number of people who are supposed to visit your grandmother or any patient?
No, nobody told me anything like this.
All right, Andrew. Yeah, it's fine. So I'm here to talk about that in particular, as well as about the visiting times to be specific. So according to our hospital policy, unfortunately, we only allow two visitors, two relatives to visit the patient each time.
What is this bullshit policy, doctor? What do you mean only two people are allowed? Why is it so? My whole family wants to see my grandmother. She is the most elderest member of this family, and my whole family will come together in the hospital.
Okay. We limit the number of people who visit is to the reason is probably just to people becoming in and out and crowding people might lead to spreading of more infections. So usually that's what we do, just to limit the number of people bringing in some infections, as well as to maintain an.
But my relatives are very healthy. There is nothing, nobody has any infection. I assure you that.
But unfortunately, that's the hospital policy. Will you be open to hearing some suggestion on how we can handle this?
I am not able to understand. Can you say again?
So I'm saying, really, I do understand that your relatives will be healthy, but is it possible that probably two can come each time and then take turns, so that each and every one of you can have time to see your grandma?
No, doctor, we want
Would
to
that
do
be
the
able?
chants. We want to do the chants together. That's the purpose of it.
All right. And so I can understand that you really want to do the chants, but is it possible to use probably some technology or use Zoom whilst others are outside and the two relatives are inside, then rotate during the different visiting hours?
No, but they have traveled all the way from different countries. It's not possible. They want to be in the room together, and you doctors don't understand my religious beliefs at all. You only care about your hospital ethics.
All right, and I can see that you're really frustrated about this, but let me reassure you that we do respect each and every religion, and we are not here to tell you what to do about your religion. Yes, we do respect it, and you are allowed to do your chants. But then the hospital policy, and in consideration of other patients as well, would want to have two relatives at a time, so that other people will not be put it bluntly,
2 minutes remaining.
if I may say. But then that's the whole reason.
But doctor, is there any alternative? Can you give us some other room, any private room where we all can go together?
Oh yes, Andrew. So I'll talk to the station manager, so that if there's an arrangement of putting your grandma in a separate room, so that you can do your rituals. Does that sound fine to you?
Yeah, that'll be good. We all plan to do around 4:30 p.m. tomorrow.
All right. So Andrew, that's the other thing. Unfortunately, the hospital policy again says the visiting time should be no visitor should be allowed between 2 to 5 p.m. as this is the silent time. Some people would want to rest, some patients would want to rest, and during that time, unfortunately, will not be able to accommodate you.
Okay, but and this so I don't understand what to do. So we also have to put Bible besides his bed, besides her bed, and do the rituals.
Sorry?
We also need to put the Bible beside her bed and do the rituals together.
Oh, okay. Yeah. So with regards to the Bible, as long as you just keep it in a clean environment, you can do your rituals, putting it by the bedside. But then at the visiting times, where there's the silent time, unfortunately, we will not be able to help you with that. You have to come during the visiting hours. Is that okay with you?
Okay. All right. Okay. Whatever you say.
All right. Do you have any other queries or concerns?
Okay, that's
Andrew?
it. That's it.
All right.
Move on
thank
to
you
the
very
next
much.
station.
Okay, what do you think, Dr. Elvin?
Well, it caught
Your
me
voice
by
is breaking.
surprise.
Your
I
voice
wasn't
is
sure.
your voice is breaking. Can you see if your internet connection be little better?
Okay, hello.
Hello, can you say again?
I wasn't sure about this.
Your voice is breaking. Anybody else who
Like
wants,
how?
your voice is breaking. Can you see your internet connection? Meanwhile, anybody else wants to say something?
I don't know whether it's such a difficult case scenario, not come across something like this.
Oh, you haven't seen this case before? It's there. It's been a frequent station.
Okay, okay.
Yeah, yeah. It doesn't require any medical knowledge. So it's just require your communication skills and acknowledging IPS. IPS is the most important thing in the solution. How you interact with the patient, how you sympathize with somebody whose granddaughter, whose grandmother is on deathbed, and is very serious for the whole family, suffering a lot. They are coming all the way from different parts of the country to do rituals for her. So it's a very tough time for the whole family. So how you relate with them, how you provide IPS, that is the core of the station. And at the same time, what solutions you provide. Of course, telling the policy is one thing, but the providing the solutions for the relative is also very, very important also. Just giving the policy is not good enough. That will only make them angry. Okay. So you need to bring out some solutions. So like this private room solution is there, then technology, Zoom call, like Dr. told, that was very good. So that is very, very important. And acknowledging the rituals, acknowledging the religion of the patient, appreciating their belief systems, appreciating whatever they are doing is the best for their grandmother. They are so caring. That is very, very important in the station. These small things which will make the station go well, because it is more of a IPS and a repo. Okay, there is nothing knowledge required. Everything is mentioned, policy is mentioned in the station. Solutions also you can provide on your own. You don't need to have any high-fi knowledge for that. Mainly it's about your IPS skills and repo. So IPS and repo is something, either it can come very naturally for some people. Some people are very good at it from the beginning only. They know how to talk. Some people are good at it. Some people need to practice it, but you cannot learn it. You have to practice it, or you're naturally good at it. There are only two ways. So if you're not good at it, you need to practice it. But if you practice, definitely this is a skill that you can master. Okay. So these kind of stations require practice for the people who are not naturally good at it. Some people are naturally good at it. That's fine. For them, they just need to practice once and they will get it. But if you're not naturally, for example, myself, I was not good in these kind of stations. So I needed to practice a lot. So that's fine. Everybody is built different. So you just practice the station 2-3 times. Once you understand, once you understand the simulator, once you understand how to, approach the situation, then it will be easy for you, because there is nothing to remember. It's just about talking. But you need to practice these stations, because it can come in the exam, and these kind of stations are as equally important as a simman. If a hypoglycemic patient is dying in front of you, or this station is equally important. Okay, so that is the importance of this station. So that is you have to pay this attention to this station in the preparation as well. We usually ignore these kind of stations, but these stations make a difference of passing or failing the exam. Anyways, let's get the feedback from the doctors who have heard. What do you think about his performance?
Hello, doctor.
Yeah.
I think initially the rapport building should be more time should be given for that, because when we tell the patient the hospital policy, they are going to get furious or upset with it if we don't properly build the rapport. So for that, I think we need to talk about her mother's condition and ask them how are they coping up, if they need any help at all, any support from our side, anyone in the family having any problem, if they need support. And if we talk about this first, and then we need to ask the questions like uh, how many people are coming, what do you do together, and do enchant it loudly or do you say it quietly or anything like that. And after that, we need to ask about the hospital policy if they know about it or not. And once they say that I don't know about it, then we need to break it slowly. that this is the policy.
That's good. That's good, Dr. Darshi. That's great. Anybody else wants to add upon it or anything else? Anyone wants to please say something, communicate. Like I told you, it's all about communication. Say something. Don't go, make use of this opportunity.
Doctor, can we, after telling that the hospital?
Yeah, Dr. Sharmeen, go on.
Yeah, actually, after explaining the policy to the patient, why can't we just go with a solution, simultaneously instead of giving them time to process the thing that we told about the patient? Can we do that?
So, can you give me an example?
Like after telling that, have you heard about the policy? And the patient might say no, and this is the policy that the patient visitors must come after 5 o'clock. But there are certain things that can be done that can help you to carry out your ritual, like providing a separate room. What do you think about that?
Well, that sounds like you're in rush. You have to allow the patient to express their anger. When you're simultaneously providing solution, that means you're just avoiding patient's emotions, because you are telling the policy, patient will be angry, patient will be furious. Okay, you have to allow that. That is also part of the station. Then you have to move on to the solution. Everything go one step or the other. If you like in the medical error, let's say you do a medical error and simultaneously you start saying we have done a medical error, but don't worry, we will do this. You bring it. It doesn't work like that. Okay, you have to do step by step. All right. Okay. Anything else? Anyone?
Yes, one more thing. At last, you agreed to everything he said. Like you agreed to come after 5 p.m. or anything, personal room or everything. So at that time, the relatives needs to be praised.
Yeah, that's good. IPS. Yeah, that needs to be done. That's good. Anything else?
Yeah, I want to say something. We can offer a religious counselor from the hospital.
I'm not sure if that is something is there. If there, then definitely why not?
Okay.
Yeah. Anything else, anyone? Okay. So let's look at so we have good comments here. So will a private room cost the family more money? I'm not sure. Whenever you're not sure, you just say, I will talk to the seniors and we will see how to arrange private room for you and what is the possible. I'll come back to you on this. So just say that. Then somebody has texted paraphrase at start instead of open question. Okay, that's always good. Like you should always paraphrase the situation and something like that. That is a good way to build the rapport. So assess the knowledge, like you did assess the knowledge, you did ask how much you know about the mother. Maybe like Dr. Darshit was talking about it, you need to talk more about the history of the patient. That will help you build the rapport. And also you will get to know more about the family and what is the situation going on. And also gather some history regarding the religious chants. So how many people you did ask? When are they coming? They're planning to come all together. You did ask that. What are the chants? Are they verbal chants? Will you speak loudly? Okay. What will you do in this? How long will it last? Wait, all these things you need to little bit ask more that before telling them, accordingly we provide solutions. If they are saying that, no, they are not verbal, they are not loud chants, it's just something silent, then there is one kind of solution. Then they say there is a loud chant, we will make a lot of noise, then there's another kind of solution. So accordingly, you have to provide. So solutions, that is management. So history, you have to gather accordingly. Then you talk about, so the reason of not bringing so many people, one is that infections can happen. That's right. Okay. They say my relatives are healthy. That's good. Your relatives are healthy. I really appreciate that. However, some patients in the hospital who are very ill and their immunity is very down, they might get affected by the germs or the bugs that are normally present in healthy people. So something like that you can set. Okay. So it's not healthy for the other people. And at the same time, it can disturb the sleep. And sleep is one of the very important aspect of the recovery process for the patient. So it will hinder the patient safety and patient care. So you need to highlight this point. This is the key. This is the most important reason that this policy has been brought up. Okay, so for the best of the patient. So if you say like that, then then the grandson won't get that much angry. Then if you just put up it like it's a hospital policy, then it will be very angry. Okay, but if you brought it up in a patient safety's context, then patient grandson will be much more understanding. Okay, then talk about when I mentioned about the Bible point. So did like acknowledging is good. Like you did acknowledge. I think your IPS was good. It's not, you're doing fine only. Maybe you could have acknowledged a little more. That's good. Whatever you're doing, we appreciate that. All these things. I think you did mention all these things. So I'm happy with your IPS. Just that in the beginning, your repo was not enough. You went to the main point very quickly. Okay, you have to ask some more questions. Then you move on to the policy rather than just asking, oh, how much you know about your mother's condition or what happened to her. Then you move on to the policy. Before that, ask some more questions, gather some history. Okay, then move there. Otherwise, I think your IPS was good. Yeah, 2 to 5 p.m. also you didn't mention in the beginning. You did mention it later on when I mentioned that I will be doing this at 4:30 p.m. Then you mentioned it. But this is also part of the policy. So you mentioned about the relatives that only 2 can visit. At the same time, you can also mention and within 2 to 5 p.m. Nobody is supposed to be visiting the hospital because it is silent hours and patients have to rest at that time. So that also you should bring that up in the talk only, because if you wait for it, then at the end you won't have much time to tell it. So just tell it in the beginning, then patient can ask you concerns accordingly. Any questions, anyone? So most important things in this station so far, repo. Okay, how will you build repo? Ask about the mother's condition, ask about, appreciate the family's intent, okay, appreciate their religion, okay, appreciate whatever they are trying to do for their mother, okay, and then ask about how many members are coming, what will they do, and how long will the process last, all these things, and for how many days it will last. Maybe they will do for many days. You need to ask these questions. That is to build rapport as well as to know them better. Then you move on to the next step, which is the policy itself. People policy. The policy will be mentioned. You don't have to remember it. Just read it and tell them. Then solutions. Solutions you have to come up on your own. It's better always to give some candid solutions so that you don't sound scripted. Otherwise, private room, Zoom call, like Zoom call was something new. I haven't heard it before, so that is a good solution. So like this, you can bring up 1 or 2 solutions on your own. Okay. Then private room, you can tell that I will talk to my seniors and I will try my best so that it can be allotted to you and all these things. Then remaining is IPS. Rest of the like keep appreciating them, keep acknowledging their religions. That's it. There is nothing else. It's all about speaking. So just practice the station 2-3 times. That's it. You don't have to practice it again. Any questions, anyone? Okay, so like this, we will be doing probably again some free mocks coming next 3-4 days. Hopefully, I'll try to make some day, and people who are not able to practice today, they can practice next time. Okay. And this is the course once again, I'm telling you because it's happening from June 11th. So in this will be a lot of everyday sessions will be there, and everybody gets to practice and get some detailed feedback from me in this course during this 5 days. And also we cover like 100 cases over all the approaches we cover, and also give you overview on some prescription and symptoms. So I think this is a very high yield, and many of my doctor students who have taken this course in last month have passed the exam with very good scores. So I'm very happy for that. So please, if you're interested, let me know. There are only few more seats left. And for private mocks, I do conduct private mocks as well. So you can reach out to me. I don't have, I think, any slots, maybe 2-3 slots left in June. You have to reach out to me. I will see if I can accommodate. July is open. So if you want to book for July, you can let me know. Okay, thank you so much. Hopefully, I'll see you again in next 3-4 days.